For all your pastry, bakery, and quality food, CK Restaurant is the only place to be. We do catering for birthdays, weddings, and all related services. We have all kinds of local foods, American, European, and even beyond. Come and have a taste of our local juice, ebe, and other services. At CK Restaurant, customer satisfaction is our priority.
Are you thinking of owning your dream homes? EJ Investment is here for you. Secure our quality bungalows with 2, 3, or 4 bedrooms, or our story buildings, 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464-838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
When we touch down, better broke down.
With Gamtel G-Fiber, now you can enjoy super fast internet in gigabytes. G-Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G-Fiber, the future is speed. Gamtel, creating a brighter future in communication.
That's how she became mine and see the
diwli lanni maaro lanni
fop lanni
awa joni mi anda honno gerdeten e ngal ɗo sabu e ngal ɗo Ibrahima jonnal taw joni mi anda se yahay kapitiki ñawloɗen ha humpodire e makko est ce que on noon e warude
waɗen no awa
ane kore Ibrahima ma kon to woni
mo Amérique
ko Amérique a woni kede humpitaki fiɓe musidɓe men baluwo ɓe andanta kala ko wawɗa wonde e aduna o si a rewi e juuɗe maɓɓe a jonnay ɗo dépassement o Gambia hara no weeɓi a yahata kadi taw ko mbuɗi ɗi no ƴawi walla no jippi ɓe haalantama ko kala ko falɗa ko sengo ñamete ili nebba maaro basal pomme de terre kala ko rewi ɗon a hendoto hara no weeɓi kadi wona ɗum ɗon tu ɓe jonnira e mobile phone siko ɗum kadi laptop kala ko wayrode jiɓe hay kaspawa ɓe wawma jonnude kadi sa fala humpitade ko weeɓi ƴettu Google account ma joni data ton waɗa download app maɓɓe on ayiyay kala ko humpima e maɓɓe ton ɓe weeɓi yama
ka wonɗa wo e aduna o
kala ko wawɗa
a jonnanayi wonɗo ka leydi men Gambia ɗo dépense
hara no weeɓi ha ma si ɗum non fof no neeɓi immoɗen joni mi ɗowtama ka place maɓɓe jano
waɗen joni
iya heɓa ko falaɗa
waɗen kisam
salaamaaleykum mbokk yi nuyu leen fii ci beneen programme fii ci Kër Fatou tey nag soo leen seetee xam ngeen ne maa ngi Innovarax Global Health xam ngeen ne health care providers lañ ñi nga xam ne ñu ngi ci réew mi exactly 1 year few months bi ma fi ñëwee ak suma team pour won leen introduce leen this new business lan lañ dee offer waaye 1 year after 2020 bi nga xam ne COVID-19 ñëw na dal si kaw àddina si yëpp how is Innovarax handling COVID-19 ak seen patients what kind of care plans lañ am pour patients yi all of that I have the honor of tey war a wax ak Innovarax team bi dinaa wax ak Hadi dinaa wax ak Ismaila CEO bi si boppam dinaa wax ak Tijan and the rest of the team kon gars yi toppaleen ma wax naa leen ne saa yu ma leen ñëwalee Innovarax rek xam ngeen ne lu bees am na fi te Innovarax mooy koo xam ne def laa fekk si sa kër gi yéen xam ngeen loolu kon léegi ñu dugg ci biir rek ñu wax waa Innovarax. Hey, hi. Okay, thank you. All right, you want to give me? Okay. And I see Lamin Manga here, my boss. Waaw Lamin, Alaaji Lamin naka nga def? So dang dee ñëw Innovarax? waaw wan leen ma Lamine maa nga nag Lamine maa nga ñëw Innovarax wan leen ma loolu waaye tey nag comme ni ma ko waxee rek maa ngi ñëw fi Innovarax and I hey Hadi, how are you? I know we cannot shake hands, right? Because of COVID, right? How are you?
I'm good, very good. Thank you for coming. Welcome to IGH a year later.
Yeah, a year later. Actually, I was here, just like you said, 1 year ago.
Also, can you
And I'm back here just to show my viewers what's been happening.
Absolutely.
2020 was a very difficult year
It was a very
for
difficult
everyone,
year,
and including healthcare providers.
Especially healthcare providers.
Yes.
Yeah, it was intense for sure, but of course we persevered.
Yep.
The way, obviously, IGH is set up, a lot of our services and products were actually really important during the COVID time.
Yeah.
You know, nothing could have prepared us for COVID, but it's safe to say we were to an extent. Like right here, this is actually our supportive care package. So it actually included over-the-counter medicine for symptom alleviation for COVID positive patients. So that was good to help with that.
So I wanted to talk about that because, I see your the IGH healthcare plan. And myself and the rest of my family have been, been taking care of that from here. Because at the end of the day, we all know there's not particularly now that vaccines are out, but before that, there was nothing that anybody can take. But there were care plans that Innovarax was providing.
Exactly. And so the products that were included in that as well. And we had daily telehealth consultations. So no one had to leave their homes. We could actually just video call you with, thanks to our electronic health record system, Agasta. And you could speak to a nurse every day. We'll figure out your symptoms and see whatever we have here with our products and pharmacy medication, see what we could send to patients. So that's why our Wellness on Wheels was actually very important in that case. Because as you know, we deliver from Banjul to Basse. So everything we have here, all our products were deliverable.
So let's talk about the healthcare, the COVID support plan.
Yes.
What exactly comes with that plan?
Okay, so the plan is $2,500. And so it includes all the over-the-counter product that we do have that help alleviate symptoms. Because like you mentioned, there's no cure for COVID, but the only solution to people who were symptomatic was to take something to actually help alleviate their symptoms. So it included that, and there was a thermometer as well to check your temperature daily. So that helped, for people to know exactly what their status is like or how their body is responding to it as well. telehealth services, so the nurses will check on you every day if necessary, because some people weren't as symptomatic or their symptoms weren't as serious. So yeah, nurses would check in on them as well. So that's pretty much what it was, and everything you needed. As you know, we have a wide variety of U.S. sourced products here, from personal care to medicine to vitamins and supplements. So they could just place an order online and get it delivered.
Actually, this was my favorite.
The immune support actually really helped.
Was favorite.
It was actually very helpful. And we actually have some of our employees here even actually just drink it every day.
Yeah.
It was very helpful for that as well.
Okay, so let's go through what you have.
So walking you through our aisles, as you know, I think this was the most important aisle, especially during COVID.
Okay.
Especially for the cough. Some people experiencing the flu-like symptoms. We had our nighttime relief because some people had trouble sleeping.
Yeah.
So some of these products were definitely included in the selections, especially vitamin C. That was another way to help strengthen immune systems as well.
Okay.
And so behind you here, we have our men's health aisle. So basically personal care products for men. We have some vitamins and supplements that were selected specifically for men. Some sexual health items, and this is just pretty much where their go-to would be. So yeah, that's been
we don't cater a lot for men.
We really don't.
So this is really good.
Yeah, so it's good to have like a section, especially obviously as we know, women shop more.
Yeah.
So men are welcome to come in, and most of the stuff they need will be in one aisle in the store.
Okay.
Yeah, so they don't have to get too distracted. They can get what they need, and that's it.
Quickly, yeah.
And so here, I think this is my favorite
My
aisle.
favorite too. I always sneak in here with the ground, okay?
Oh, wow.
Yes,
okay.
I do a lot.
So that's good to know. So
Yes.
as you know, our For Gambia by Gambians, or FGBG, is our give back to the Gambia, essentially. So every product you see here is produced locally by entrepreneurs who are Gambian as well. Wow. So I think it's a great opportunity to have these here, and every single product here is on our website. Wow. So it brings the diaspora in. Yeah, and they can order any of these products for their families anywhere here from Banjul to Basse, and we can get it delivered. So it expands their customers as well.
That's great. That's great.
It's amazing.
Yeah.
And I think that's the best thing about the website is some people just don't realize how easy it is to order online and get it delivered.
Yeah.
You pay, it's cashless, especially during COVID too, or you can order contactless, pay, get it delivered to your doorstep, and you never have to leave your house. So that especially was important for people in quarantine.
Yeah. Especially if now that with COVID, people don't hardly go out, so that is very important.
So that is very important. So here we have our GI health. So this is another aisle that we have a wide variety of. People have their preferences sometimes, different types of laxative, antacids, and digestive health vitamins as well.
Okay.
And right here,
pain relievers.
Yes, this is all our pain relief.
Yes.
And first aid. So we have your Band-Aids, all the different types of pain relievers as well. Because I actually had to learn the difference between like ibuprofen and acetaminophen.
Yeah.
Yeah, I didn't know that before, but definitely here they're all highlighted. And as you know, we always have wellness consultants here as well to help anyone find whatever it is they're actually looking for.
So most of these things are over-the-counter items. But when you come in, do you get advice as to what to take?
Yes, absolutely. So our pharmacists are also always available. So usually when someone comes in and they have a problem, we're like, okay, we'll connect you with the pharmacist. Yeah. And they can tell you, maybe this is something else you need. Perhaps you need a prescription. They can look into that as well. Or they'll actually come with you and help you find the products that you need. Okay. So I think this right here is one of our most popular aisles as well.
Yeah.
Our vitamins and supplements.
Yeah.
I think it's safe to say we have the widest variety in the country.
Yes.
For sure. Like anything you need as far as vitamins and supplements go, we have it. And I think it's important for people to actually learn the benefits of vitamins and supplements as well. Yeah. Yeah, like vitamin D. I didn't know melanin kind of stops our ability to take this in. So this is a very good supplement to have as well.
And the QC brand.
QC brand, exactly.
This reminds me of Walgreens in the US.
Exactly. Yes, absolutely.
Yeah.
I think that's the beauty about everything we have here, because all our products are US sourced and FDA approved. So, I'm sure you've heard, sometimes fake drugs in the country, really bad quality things. I think that's safe to say that that's a problem we don't have, because the problem the U.S. doesn't really have. So everything you see here is U.S. sourced, FDA approved, and it's quality guaranteed.
Oh, great.
So everything here is well vetted as far as that goes.
Yeah, great.
Again, here we have our point of care testing and telemedicine room.
Yes.
And so here I'll pass you on over to Fatou.
Hi,
She is
Fatou.
our health outreach and communications lead.
Good.
So she'll take it from there.
Wow, thank you very much. Hi, Aji, how are you? I've been here actually.
Have you? Yeah.
And I think the reason why I love here is I can consult with my doctor in the US, and they can just set appointments for me, and that is very rare in here.
Yeah,
so what do you guys do here?
Yeah, I think, as you mentioned, I think it's really cool that we provide telemedicine services because that's something that I believe is pretty new to the Gambia in the sense that if you are in somewhere far away and you don't have access to come to the clinic, you could easily telemedicine our professional doctors or professional healthcare providers, and they could provide you services via video call or phone call. So I think that is really cool here too. As well as we use our electronic record system, Agasta, which provides medical records for you. And if you go anywhere, you can just pop up your Agasta medical records, and it's easy, it's convenient, and it's paperless too. So I think that's pretty unique as well.
Yeah.
Yeah. Right here, we have our point of care testing room where we run all our tests. So if we do a blood glucose test, if we do a uric acid test, our various health tests would be conducted and tested in this room. And I think that is also really important because we do all of it in-house.
Yeah.
And so, yeah, which is why I think these two rooms is where a lot of the magic
happens
at IGH, definitely.
Yeah. And then one thing that I have always talked about when I come here is the Agasta. Is, you know, what we have here is the paper system.
Yeah.
You go to RVTH, your records are lost. But whenever I come here, the last time when I was here, what medication I was given, what was the diagnosis, you know, everything in this is in the system.
Yeah.
That is very new to a lot of us.
Yeah, I'm so happy to hear you say that too, because that's exactly what we wanted to do. We wanted to make it convenient and accessible for Gambians everywhere. Because, you know, I lose papers. I feel like everybody loses papers. It's hard to keep track of those things, but if you come, you give us your first and last name, your birthday, boom, it's in the system. We pull it up. We can see your health history. We can see all the stuff you've done before, and we can provide an accurate diagnosis for what you need as well.
So one thing also, because a lot of us have doctors abroad, and during COVID, no one was able to travel because there were travel restrictions. So if someone has a doctor abroad, are you able to set up appointments for them so that they can consult?
Yeah, so we have our own in-house doctors, but if it's necessary, we could facilitate that, right? If you wanted to contact your doctor, but they're in the US, you could come to us and we could find a way to facilitate that interaction to make it easier and more accessible for the person. Yeah.
And also accessible or affordable is your like the testing. I know I've done the full blood. I don't know, how do you call it, the full, you know, just to test everything.
Yeah, definitely.
Because sometimes they can come to your house, and sometimes you can just come here. It takes a number of minutes, and you get the entire results in days in your email.
Yeah. So pricing varies depending on what you get tested, which is also why we have a comprehensive test.
Yeah.
So comprehensive wellness test, which means we test for everything for a certain price, right? So we provide your blood glucose, your high blood pressure. We also provide uric acid, pretty much everything you would need to get an accurate assessment on what's going on with you health-wise, we provide here. So I think the price varies, and that's also why we implemented our health packages. So we have various health packages. We have our assurance quality plan. We have our Circle of Life plan, which is for maternal pregnant women, and we also have a geriatric plan. And so with these plans, we provide the testing, we provide the nurses, and so we do weekly in-house check-ins. We also provide monthly prescriptions, and we also provide various telemedicine services. So it's pretty kind of like an insurance plan, but not really. But it's sort of something that just makes healthcare accessible and, again, easier for Gambians.
Wow. That sounds interesting. I'm so excited. I mean, I know all this because this is also my healthcare provider.
Yeah,
so I do a lot of this. Especially my older grandmother. I think for me, I appreciate this kind of service more during the COVID. Is when you have an older patient and you're scared that they will contract the disease when they go out. You want them to stay, you know, your wellness on wheel. They deliver her medications. You know, they check her blood pressure at home. They just bring their service to us at home, and that was very refreshing, knowing that she doesn't have to go to the hospital, but the hospital comes to her.
Exactly.
That is exciting.
It makes me so happy to hear that you feel that way. Thank you so much. We love hearing testimonies because, I mean, again, to try to make it easier for Gambians everywhere. I mean, we go from Banjul to Basse, right? If you call us, we could come with our Wellness on Wheels services and provide you in-house treatment and services. So.
And I think I always say this, people should understand, people always say how affordable. I am hooked up to this service and I know how affordable it is.
Yeah.
So I think it's important for people to know it's not just,
It's
not for the elite or the rich people,
No,
but it's
no.
for the ordinary Gambian.
Yeah,
The price
exactly.
ranges, I mean, I look at the aisles and I'm thinking 200, 150.
Exactly.
That's what you see
You
on the
can get
aisles.
tested here for less than $100. A malaria test here is
Yeah.
$100,
Yeah.
right? I think our prices are very, very affordable, and I think that's why we wanted to bring it to Gambia and make healthcare for Gambians affordable, because we are a company by Gambians for Gambians, and Gambians are our main priority.
Yeah. Thank you, Fatou.
Thank you so much.
I love these two rooms though.
Yeah, definitely. Yeah, this is where a lot of the stuff happens, but
Yeah.
I'll also show you a really cool area as well that we have.
Yeah.
So this is our pharmacy.
Oh, okay.
So this is where we provide all the prescriptions medicine, all the medicine that has been diagnosed by the doctors that is not over the counter. This is where people come, right? And so this is where we can provide services.
Oh, I'm always looking at this place.
Yeah, no. So this is a lot of over-the-counter medicine that you can know, ibuprofen, Tylenol, but if you have serious prescriptions that the doctor has diagnosed, you can come here. And I know that I also run the Wellness on Wheels program, and so at IGH we believe in corporate social responsibility, which means that before it gets to the point of being a diagnosis, we want to see how that we can prevent that. So a main thing that I do at IGH is that I go into local communities. I think we recently did one in Tangi and Borsodi, and we provide free blood pressure and free glucose testing to make sure people know what is wrong, make sure people know that if there's something that needs to be treated, to come to us and provide services for them. And so this is a free service we provide. And so people normally come and we see someone is diabetic, or we see someone who is on high blood pressure medication that isn't really working for them, we tend to recommend them here. They talk to our doctors at the consultation room. We provide the testing, and then we bring them here to the pharmacy to provide them the medication that they need to treat their chronic illness.
That is interesting. Going into the community, the outreach, that is interesting. Because a lot of our people, we don't know our status.
Exactly.
We get sick, we get to go to the pharmacy, buy our paracetamol. That's all we do. We don't know whether you're diabetic and you continue eating the same diet. It affects us. So that might be something that can be really, really effective.
Yeah. Thank you so much. It's a process we're starting. We're trying to also implement an educational aspect, not just, hey, you have high blood pressure, high blood sugar, but also actually educate, actually teach how to eat better, how to change your diet, how to change your lifestyle to live healthier, so that before you even come here, right, we can treat you at the source, right? But if we do find people who are kind of at the chronic illness stage, then we would refer them to the clinic and to the pharmacy to give them treatment. But
How is the community receiving you? Because this is really interesting.
I think so far it's been mixed, but I think a lot of the times it's a lot of just getting to know the community, right? I think one thing that's important is to understand culture and tradition. And so one thing we always do before we go into a region is we go to the local alcalde. We go to the alcalde, we ask for his blessing. We ask, hey, this is what we want to do. Is this okay? We talk to the local imam, and they normally help facilitate an easier transition into the communities. And I think I've definitely noticed when we do that, response is a lot. A lot of people are more willing to come to our services and a lot more willing to provide testing. And so just respecting our culture as Gambians has really helped a lot. But I think a lot of people have been responsive, and it's been really helpful. I think recently we found 4 people who were diabetic, who were late stage diabetic, who really needed treatment and services. And so we were able to call them up, and they were able to come to our clinic and get the help that they needed. And so,
Wow, that's life-saving.
It is. Thank you. Yeah.
Wow, that's interesting. Interesting. I'm glad we have this conversation, because the reason why this is important is a lot of people will think, just like I said here, this places like this is for the rich people, but you're going to the communities, offering these services, letting people know their status is important.
Exactly.
Like I said, a lot of people are diabetic. People they have pressure or high blood pressure, but they don't know.
They don't know.
And they just take any medication just to ease the pain. So it's important. These kind of services are really important. Yeah.
And we really want to tell people not to be scared of seeking help. It's important, because one thing that makes us unique is that we are actual Gambians who actually want to help other Gambians, right? And so we really want to make sure that we implement lifestyle changes to help them. But I think a big step and a big hurdle is actually getting tested, right? How do you know something is even wrong with you to say that you want to get tested? So by us going into the community and providing these free services, it really is an eye-opener for a lot of people that, they need to come and check and get help. And even for us here in the clinic, we provide free blood pressure and free glucose testing to anybody who comes to the clinic. So if you come, that's a promise we made.
You can walk in and
you can walk in and say, you know, we want to provide, you want the service, and we would provide you with the service to make sure we are on the same page. And if there's something else that you need checked, we would also provide those services for you.
Interesting. If you're watching and you want to know your service, just walk in here at the Fatou Plaza.
Yes, please do
opposite
come.
the IEC. It's important. It's important to know these things. It's very important.
Definitely, especially diabetes and high cholesterol and high blood pressure are the #1 killers in the Gambia in terms of non-communicable diseases. So we really want to try to help mitigate those risks and have people come on down. Yeah.
Thank you very
Of course.
much.
So right here we have our pharmacist, Aminata, and she's going to tell you a bit about what she does here at the pharmacy.
Hi, Aminata. How are you? All right, you guys good here? Okay. How is everything going on here? Oh, great.
What we do here is an electronic prescription processing system.
Yeah.
Where each patient will have their personalized labels where they show them how to take their medication.
Yeah.
And so they also have a unique Rx number where some years to come, even when the patient is not around, when you put in the Rx number, we'll be able to track what the patient was taking and the doctor that prescribed the medication for them.
Yeah.
So it helps us to do accountability for what the patient was taking, the history of the patient, and all of that. And we also have the date when the prescription was dispensed, and the expiration date of the medication as well.
Yeah.
So it's really something that is.
I always say this: presentation matters in anything. For me, it's the presentation, it's the branding. You know, I come here and I don't get any smell of medication. You go to pharmacies, you get sick first. So this is important, the packaging, the presentation, and also, you know, just having everything clearly spelled out for customer is important.
It's really important.
Yeah.
Because sometimes we go to the pharmacy and get a medication and maybe just the labels are not clear.
Yeah.
So what is told to you at the pharmacy will be different with how you're taking the medication.
Yeah.
But when you have everything personalized and labeled, you'll be able to know how to take the medication and you will not skip a dose. And it's very important to not skip a dose when taking it.
Yeah. Thank you very much, Aminata. Thank you so much. All right.
Great. So thank you so much. Aminata does a really great job here, and we're so
I love the
grateful to have her.
presentation. Yes.
Thank you so much. And so this is Tijan. He is
Yeah.
our sales lead, and he will also tell you what we do from a sales standpoint.
Yeah. Tijan, how are you?
I'm great.
It's been a while.
It's been a minute.
Yeah, 1 year into coming here. I know we were here last year.
Last year.
Nata Jang. You know, of course, Innovarax, 1 year, couple of months. Jambe ñaadi le ko 1 year ni bitem, especially with COVID.
Oh, pretty much come
Yeah.
It's been a year when you were here last, and so much has changed over the 1 year,
Yeah.
including me personally.
Yes.
Because last year I was working at a point of sales, but now I'm working as a sales lead.
Wow.
So pretty much what that means is trying to move the wholesale to another level.
Good.
Like you would see, Innovarax brings a lot of quality products to Gambia, all sourced from the US.
Yeah.
If you look around, you see a lot of QC brands.
Yeah.
What that tells you is some people might ask why QC, but QC is a company that's been in the US for over 90 years, researching drug development, trying to make sure it is best for what a customer can consume.
Yeah.
So they have 90 years of experience with products, and then we thought, who is the best person who is doing it good for 90 years, and then bring it to Gambia just to change the culture a little bit.
Yeah.
So even with that, a lot of things has changed, and it's not even just about fee, as in combo rec. Over the while, the phone pretty much.
Yeah.
That are for Bolonkono. I've gone on trips, 3-4
So
days
no,
trips.
mol ba fula ko Innovarax dan ta janda male. E ko ditiol da male kara. Ninga advertisement okay watu wari ka ko no onko alla ko ditilo pitano lo. So you telling me ko itara fo basse nyolto. That is interesting.
Ya lan da bata makade. So no Bolonkono. Ado nalo mama ning bamal.
Ibe
nyina sotoka. But the phone will tell combo jang. That for basse. Ning ko basse I don't mean as basse come as a country. I mean as in distance travel only.
Okay.
Because it was country round. Dada Jarasoma, Dada Kauru, Dada Kudang, Dada Basen, Dada Fokoina. Imagine the phone in the Montana.
Wow.
But pretty much I can know Nyaming is Borol Mulbijandal, pretty much Newal Tata, and then Masul, blood pressure check, blood sugar, Puka understand yalo mo jamal ben na so okay ba grupo nyek eka hypertension so wala diabetes buka ku jamal on noje so moling borol tata ni ku ko taw dara ngay be screen mo won yalla ko isulata hypertensive medication wala kondimio mala sama senelal na sama ko senelal ko dimio te dimio insifal be nga borol wa fi gala and then even way cheaper than ga wa fi mun najak cuz nte ni wul direct I make sure I sell to everybody wholesale price. And akara nyami bepere Intel as a company, more my love ka products all muta pour Intel for the man. Wala nang I moved out of the pretty much come benung position of just to go into wholesale. Because we are trying to make sure at least every 5 kilometers is a time no damage. As a each Innovarax store, no Innovarax store, even other hospitals as well. Produce the same quality of medication. And then talking to you today, I am very frustrated because the time I'm in Dundana. What time I'm in Dundana. Wow. Because not uncle because I've been out of the country. I had a Loptano road that. He spent a lot of money, to be honest. And then over 3 days, nobody actually knows what is happening with him. They've been giving him drugs. They've been doing all these other things. Why there was no chat history to explain. What happened, no documentation. And I was so frustrated. I had to wake up today in the morning, bring him here, do a lot of other things. And it's not just about selling to us, it's about experience. Because it's places I've been. I swear today, I was so frustrated. And there's a lot of people going through this. Even not us. And that is the beautiful thing about IGH. We're not leaving everything to us. We want the whole country to be on Augusta. Moleta Basse, Yeta Buyam, Yeta Kiang.
For me, Augusta is the biggest deal for me. Because personally, obviously, I've dealt with people. The critical condition because medical records so akumaya back a quick access to the medical report.
And come kafe nyami yalong nibe siring namanta faye ma. Ibuka understand what the difference is. Ano akadante wanya anunta do wala jana every day. Therefore, personally, I had an Augusta account since IGH started, and that was the first to have a medical record. Now, it's until a file oil no allergic to last 1 month namune ming but Tata after that for a family member, exact family, who spent over 3 days in a hospital with no records. It's frustrating.
It is.
So then we took other steps, we moved him out, and it was as simple as Abefono can no back. I just came here, picked up oral rehydration shock. Nadia, I stopped completely. And that is being happening for 3 days. Nobody knows what is happening, and that is how frustrating it is. So even with Augusta, with the quality of products that we have, we are open to putting it out to the whole nation. I think people should look into that. Because how stressful some of these things is, come now until you go through it.
Definitely. I think I'm one of your biggest when it comes to advocates of some of these things, because obviously, Mama, about the program, or not Uncle me, Uncle whatsoever, because of some issues. But today, alhamdulillah, we can say, he's pretty doing pretty good.
I'm all PR business.
You
don't know exactly.
I've always,
you go through
I have said this. In the book of business, all of my partners in the book of business, it's business. You can but advocate for it's because I experience. So for me, when I endorse something, it's because I experience. And that's why anytime I call you 24/7 because I just want to say, this is something we are going to endorse, and I want to make sure coming for a right.
But that is so serious, Fatou, that every weekend, let's say Monday, but Thursday, people across this nation, rural, Farafanya, you could order any medication, quality medication, prescription, over-the-counter medications. Every Friday, medication will distribute. And then even with honey screenings or testing, just last week, we have people who went all the way to Kauru and this other village that I can't remember the name, did all the series of tests, a medication will be dealer, and they came back. And this is something that's been happening. Just to make some of these
but honestly, I think it's important it's not just us ndol mi be ndol inta fembe to sotola, but minu fana be santo fana, they deserve stuff like this.
A lot of
so
stuff like
this. It's important that you guys are going there to offer the service.
Na moto sotola ni radal mu yang ko kata bolon kon all the time. So we can accessibility between quality and care is no more there. Bridge on into anymore. Because ni entel call entel bitale ngeta. Come na fa nyame this is the same thing where ndafon ngawule ngata ko base an ku kata. Just to make sure pharmacy will bolt down la, but even towards places where entire la fancy ta marché blanto kamol batu yana yela problem explain mo le ajibe en say mako no nyaming abe tamane nyina anu ninga fo it's not even about financial because it in the lamo do ja mo do mo gada wodam bandam ba fuelo wala a collata back but niaje we are willing to do most of these sacrifices because we've seen conditions where personally either a mama or like uncle or like cook around the same thing. A lot of people may uncle. Ato do fang wato da sita dalam bar kodol bije amanya na kata anya na kasone ya what you know. So a lot of products bijang wholesale is open. Balong konon kol fanang ibil da bije. So even people in the diaspora easy to understand where ikak telephone da manesika ida message ki wala call ke. The same medication, say come the US, is the same medication we have base. Yeah, pretty much.
Pretty much. Yeah. Wow, thank you very much, Jana Barka Bake.
Hi, Fatou.
So, saying I'm Ismail Paretale. Na fanse kachano.
Definitely.
Kajuwe kong nga fanya mindron 1 year into kabin nata jang mune falinta.
Ntafe 1 year kele mun falinta
asiya
ndafo yavara na.
Ita fa falinta. Hello. Welcome. From the name of right? COVID, yeah. Thank you so much.
You're most welcome.
Yeah. Welcome back to IGH. I am here with Dr. Ismail. Doctor, welcome once again to Kerr Fatou.
Thank you. It's always a pleasure when I get to see you guys around.
I've been here a couple of times, but you're always busy and I don't always want to disturb, so I just sneak in, do my consultation. But how has it been 1 year after our visit, 1 year, some months after, establishing this magnificent business? How has it been?
I think it's been a long year. The 1 year, sometimes it feels like 5 years because so many things have happened. And more than anything else, the company is evolving constantly with the demands of the market. So more than anything else, the first year allowed us to learn. Learn a lot about doing business in Gambia, but also learn a lot about internally what company we want to be. What do we want to be known for? Do we want people, when they hear Innovarax Global, to think quality, to think innovation, to think service, but more than anything else, to think assurance, peace of mind, meaning anytime you enter the facility, whatever service that you have, it gives you a peace of mind knowing that it's what you need, right? But the interesting about that is that comes with a lot of responsibility because you make a promise to the people that this is what we stand for. So internally, you have to always be reflective and hold yourself accountable to what it is that you're selling, which is a promise. And I think 2020, with all the challenges, all the growth, the company has always been intentional about trying to be better. Not only once, but every single time. So I think a lot of people like yourself that even knew the company in the beginning, or even people in the diaspora, their experience then and even their experience now, it's a different company. So it's been a very interesting year. And what I normally tell people is Innovarax Global, from the outside, it's a healthcare solutions company. A lot of people struggle to define what we are, right? The easiest way to define it is we use technology to help people get or stay as healthy as possible by delivering quality healthcare services in the most convenient way. That's the umbrella of what we do. Some people, it could be retail products. Some people, it could be pharmacy products because they have a chronic condition. But the end goal is how do we democratize access to quality healthcare? But also internally, I don't think we're a healthcare company internally. I think we're a human development company internally. Because in 1 year, we've hired 52 Gambians. Our staff is 52 Africans.
Wow.
And Africans, because we have representation from across the region.
Mm-hmm.
That's a huge undertaking.
For 1 year.
It's a revolution within the company,
Mm-hmm.
because to us, we wanted to be that, where you come in, you see young African faces. But even for individuals like you see the development that's happening within staff. Our nurses now are using electronic health record systems routine.
Yeah.
So now they're on the same level field as a nurse in a national field.
Yeah.
All the different fields were forcing them to be uncomfortable and grow so that we could always be something that Gambians like yourself could be proud of.
Mm-hmm.
Is it easy? No. Because for a young company, any person that I say, okay, our payroll budget is $500,000 a month on payroll. For a young company, it doesn't make sense.
It does not.
But what I tell people is, it's bigger than healthcare. We have a lot of young, talented Gambians that we need to invest in them by giving them opportunity, create an environment where they could grow while you hold them accountable, but also pay them a living wage that restores dignity back into the community. Because for every IGH employee, there's their mother, their son, their children that they have to take care of. So the healthcare, I think we've made a lot of impact. But for me, that's what I'm most proud of. The human development element of it as well.
So for me, for a young company, 1 year into the business, obviously healthcare provider, 2020 has been a difficult year for us, but more so for healthcare providers. And one of your areas that you specialize is the Wellness on Wheel, where you go visit people at home. But I think personally that you had a surge during the COVID period because no one wants to visit the hospital. Everybody stayed home. And as a small business, this is something you specialize. How did COVID push you? Did it affect your customer care? Because now you had more patients to go see. You have more customers to look out for. How did you manage the challenges of COVID and be able to also safeguard that quality and assurance that you always want to keep for customers?
It was a challenge because I think it was the first stress test for the company in two ways. One, do you have a good idea? A lot of our business plan, when I tell people telemedicine was part of the business plan, Wellness on Wheels was part of the business plan, point of care testing was part of the business plan. All these things that now, even all over the world, healthcare companies, because of COVID, have to add these elements to their business when that's how we were created.
But you were created that way.
Exactly. And I think I don't think coincidences happen. Like opportunity, preparation.
I remember when we first had this interview, you said, Fatou, this is the future of medicine.
It's the future of
telemedicine is the future. And a few months into that, everyone was tested. But you were prepared for it.
And also what it did was, it gave Gambia a sense of reality. What happens when even the wealthy can't travel? That's what COVID did.
Yes, it did.
People who could run to the US to get medications couldn't travel. Right? Locally, people were struggling with getting access to medications. Everything was in shortage. So it allowed us to introduce ourselves to the country and the region as solutions could come from within. So that's what COVID did. It added a lot of stress though, because the demand increased way more than a young company could handle. From an inventory standpoint, it was capital intensive. The training human element growing fast. So that came with a lot of challenges, but it was an opportunity for us to see who we were, but also validate our position in the market as people who are willing to stay and provide the care that people deserve as well. So it was both ways.
And I know we had a lot of COVID talks during the tense period on our platform, Let's Talk COVID. It was very helpful. A lot of people would say, can you bring Dr. Bai? Because people were scared. People needed to know what they should do. I remember staying home 2 weeks, not leaving my house because I was worried. and I had anxiety. And you know, when we had my first show, and just listening to you and giving me the prep talks, what I need to take, what I need to do, like some of the things that were available locally, it helped to empower me, and that was helpful when we did that. But I do know that there was so many other people. That information that I got helped me also prepare my family, my friends. There were so many of my friends, people that were infected, people that had the hospital were not able to take care of them. We had to recommend from them, got them isolated, and you know, we got them proper care services. Absolutely. I want us to talk about your IGH healthcare, how do you call it, plan? Because
so the
care plan is my go. That's my everything. You go to my house, I think I have a pharmacy there. It was very helpful. Yes. To all my friends and relatives, it was really helpful. And up to now, this is what people need to know. They need to have that at home. Everybody should have a healthcare plan when it comes to COVID. Yes, vaccines are here, but how many of us have access to that?
No, absolutely. And that's something that the moment COVID hit, we figured you could either have multiple conversations with multiple people who have the same problem. I have COVID. You have to manage the symptoms while your immune system does the rest while in isolation. So we figured, let's create a COVID care package that our doctors, general practitioners, our pharmacist team sat down and formulated everything somebody needs to recover fast. Rehydration with electrolytes, fever reduction agents, immune boosters, a thermometer, and package it in a way that now we could just replicate the same information to a lot of people that needed it. But more than anything else, with Wellness on Wheels, encourage people to stay at home and the product deployed directly to them. That revolutionized how people consume healthcare. And I think even after COVID, what our model does is it makes people realize that, one, healthcare should be preventative, not emergency all the time. Our health systems are overburdened because a lot of times Gambians don't believe in preventative healthcare. So things like the COVID, care package, it's designed to help you recover. But even additional plans like the wellness screening, where we're encouraging Gambians, come get tested, come get an electronic health record system. Even any doctor that you go to that you present an electronic health record, you've made their job easier. Because good information allows them to produce good work. But COVID just allowed us to infuse a lot of those elements into the market. So it's been good, and it's still ongoing. That's last year, and people are still having COVID. So the need is still there.
The need is there, and I know that we can always have access to most of these things here, especially the mask. I saw Dr. Salou Tal, the president of the Gambia Press Bar Association, was here, and he was also talking about the cost. I think for a lot of us, is the customer service. Because, no offense, but as Gambians, we are not known for that extra customer care delivery. We just treat everybody just like, here when you come in, you don't have to be Fatou Toure or Dr. Baji or Salou Tal. You walk in, you're treated like a customer. Everybody is treated the same. And I recommended a friend, and he was like, do you want to call Dr. Baji? I said, no, I don't have to call Dr. Baji. The system is designed in a way that you walk in, you get your services. I don't call Dr. Baji myself because I know when I go there, I'm treated. So how do you manage that to make sure anytime anybody comes in, everybody is treated the same?
It's a company culture. When I was coming home with this idea, so many people told me the Gambians will spoil the business for you. It's a good idea, but dealing with Gambians, they will bring the business down. So internally, we preach the message that everybody expects us to give mediocre service. Or even if we give good service, we can't give good service all the time. So now we're going to fight with our own tendencies to be something different. Because especially Gambia being that good service, normally you're either non-Gambian or a Gambian of privilege. But dignity is universal. So we believe that dignity should be democratized. But more than anything else, it speaks a lot more if a Gambian feels like a fellow Gambian is providing good service irrespective of who they are. That's our internal revolution. I talk about it all the time with the staff. most people don't expect good service.
Okay.
But how do we do it consistently to show people that for us to get better, we have to be better?
Yeah.
And it's become a company culture. It's difficult because it's a constant negotiation with human beings. There's so many elements. But I think that's what we want to be about. A company for Gambians or Africans, by Gambians or by Africans, but not only do it once, let's do it all the time, and then it becomes infectious. And I think I couldn't be more proud of the staff that I have. You've seen the amount of young talent that I have. You know, you've seen them. It's just, it inspires me because they represent everything that I knew we can be, and I know we could be even better. So that's the exciting part.
That's the exciting part.
Yeah.
A lot of people, you know, when you advertise for businesses like this, and they'll say, oh, Korean ñu am alali lañ is for the rich people. Just talking to Fatou and Tijan, they're telling me they all go all the way to Basse, to Kaul, to offer services. And I'm thinking, you know, how affordable can that be for people in the upcountry?
It's a decision that we're a for-profit. Every business is in there to make revenue, because that's how you stay.
Yeah.
But we also figured out, when I was coming back to Gambia, very often I saw reputable companies that did not have a corporate social responsibility. We figured that if we want to show Gambians that we are committed to their health and well-being, we have to choose which elements we could remove that are barriers. Cost and transportation are one of the biggest barriers that most Gambians face. So the fact that my team now is they're going up country with What's Your Number, we are meeting Gambians in their 40s, in their 30s, who have never checked their blood sugar, who have never got a routine blood pressure check. So when we see things where most Gambian men are dying at the age of 60, diabetes and hypertension is growing, it's because access is not there. So it costs the company money.
Yeah.
Investors will even tell you that's not a wise decision because you're losing money. But for us, it's our promise to the country that health and well-being, we're in the business of providing healthcare solutions. And what I say to that most of the times is sometimes telling you, Fatou, we don't have a solution for you here, but go somewhere else. That is a solution.
Yeah.
So there's a level of knowing where we could stop, where Sinkatan from La Elo, what we could do. And also that's how we integrate with all the health systems, where now, even if you come and do a health screening and we find out, okay, you need to see a specialist. When you're going prepared, and the specialist is prepared because there's good information going.
Yeah.
So those are the mindset, but just removing barriers of access. And it's been a very, very good journey for the healthcare professionals as well to see the disparities in health.
Yeah.
And for the diaspora, what it's doing now, it's allowing their loved ones to stay in the villages, but still receive the same level of care as somebody in another country. That's a revolution in healthcare that changes the entire landscape. And it's just something we're extremely proud of.
So yeah, that brings me to my next question, the diaspora outreach. Because I know a lot of people in the diaspora who would want, who would take their parents to America or the UK for treatment, because obviously we didn't have something like this. And now they can channel all of that too, especially during COVID. Yes, you might have the money, but there's no access to travel. So how is the diaspora outreach right now?
We're a company that's diaspora led, because I am of that.
Yes.
I used to be the person who had worked as a healthcare professional in the US, and my mom, who lives in Gambia, has diabetes and hypertension.
Yeah.
But she never consumed Gambian healthcare, because I got medications for her in the US. I was trained to do the point of care testing, so when she comes over, I could tell her what's going on. There were many people like that who did not have an Ismaila who's a pharmacist in the US. So when we started, the diaspora was a community that we wanted their attention, to let them know not only are we providing quality services, but everything we're doing, all the products, we're getting it from the United States and bringing it where now we want you to trust the care of your loved ones on us to provide services. And sometimes going back to information, just so that you could know from a diaspora standpoint, what is going on. So the fact that you could send your loved one and purchase a wellness screening, for example, and then we could call you or send you a report with the patient's consent of what's going on. Now it's a different relationship from Western Unioning somebody money and not having any answers. So it's also a system that's built on accountability with our e-commerce platform. There's transparency in what we do. And for our care plan, for example, people always say, $760, who could afford that?
Yeah.
My answer to them is, how much is a plane ticket?
Over $1,000.
Right?
Yep.
So for $760, you get a comprehensive screening. Anywhere in the Gambia, you could get monthly prescription medications delivered to you. Gambia doesn't have a lot of doctors. Now we're doing telehealth services where we're using technology for consultations. So we're bringing all of that to your home. So healthcare cannot exist without you paying.
Yeah.
And prevention is always cheaper than most people who have to run to Dakar.
Yeah.
And that doesn't always mean good outcomes. So I think it infuses more trust in the system. And Gambia now is starting to have a lot of healthcare professionals who are global healthcare professionals who are choosing to perform in the Gambia. Right? So from our orthopedic surgeons, for example, like that, that's a global doctor, just an example, who's choosing to perform in the Gambia. It's different. So we have to also change our mindset that value could be created and consumed here.
Yeah.
So the diaspora, that's why we listen to the diaspora too. Because they have a level of expectation when it comes to service.
Yes.
That doesn't make room for excuses. They pay, they expect a service. So for my staff, they're now understanding the psychology of the American consumer. Meaning if I'm paying my money for something, you have to be consistent on your product. So I think it's a challenge we welcome, but the diaspora, I think we are positioned to continue that relationship with them to make sure we can just help their loved ones stay as healthy as possible.
Yeah. So if for those, for our new diaspora viewers who maybe want to register, what's the process like?
We've simplified the process. What our e-commerce platform did, igh.gm, it made it where anybody in the diaspora, be it a care plan, be it a comprehensive wellness screening, even if they just wanted to purchase some Colgate for somebody in Basse, you could go on our website and literally purchase it and Wellness on Wheels will deliver it. But from a clinical standpoint, we always tell people in the diaspora, start with a foundation, which is our comprehensive wellness screening. It's a 12-test exam that gives them an electronic health record system, screens them for diabetes, hypertension, their kidney function, their liver function test, their electrolytes, their vitamin D level. That comprehensive screening, we designed it as a foundation where any institution you go in the world, that's information they need to do anything else. So that's step one. If they're healthy, fine, you've done the screening. For individuals who have chronic conditions, diabetes, hypertension, high cholesterol, that need continuous management with medication, that's where the assurance care plan comes into play.
Yeah.
Where now you could purchase that, they'll do their screening, they do a consultation with a physician, and every single month, their prescription medications are delivered anywhere in the Gambia.
Yeah.
And what that does, Fatou, is and now I'm speaking as a pharmacist, is it increases adherence.
Yeah.
Diabetes and hypertension, the cornerstone to people living longer and staying out of the hospital is, are you on the right medication all the time?
Yeah.
And also every so often, you're coming in to check to see where your disease is. That way either they could increase the medication regimen or optimize it, or some people who are doing well, they've lost weight, they're exercising, sometimes it could go the opposite direction, where some people with diabetes start coming off of some medication.
Yeah.
But it allows that continuity of care. And Innovarax Global Health, why we call ourselves a healthcare solution is, once you enter the gateway, there's continuous monitoring of where you are just to keep you outside of the hospital. That's always what we aim to do. If anybody who has diabetes and hypertension, how do we prevent you from being hospitalized? How do we prevent you from getting your leg amputated? So we're removing all the barriers, and now people in the diaspora have peace of mind, knowing that, okay, I know what's going on, but also I know where my money is going. So those two elements, starting point, comprehensive wellness screening. especially for people who haven't seen a health system in a while. Wow. And then the ones that need management, that's where our assurance care plan comes into play.
I have seen you guys partner with other health facilities, especially Bundung, providing them the Augusta. I've just told TJ, and I think that's my favorite, part of your service, having a proper record system where people can always have access to their medical records. So tell us about your partnership with other healthcare providers.
Most people that know, Augusta is the one element of the company I'm most passionate about. Yeah. Because it already has revolutionized healthcare in the Gambia. Our institution, we have never operated on manual records. Every single patient that has ever entered Innovarax Global, if you call us right now, we could email you a report of every single clinical encounter that you've had here. So when we brought Augusta to the African market, we decided not only with public institutions, but private institutions, we should move to the era of healthcare where a scribbled paper should be a foreign element. But also what it does is it's increasing capacity of nurses, where Bundung Hospital, for example, when we met Bundung, they were the most ready from our analysis. The whole net computer was connected. The management was on board. We told them, we're not going to tell you we're going to sell you Augusta. Give us the opportunity to implement it free of charge, to train your staff free of charge, and show you what it can do. Where now the antenatal cards that women are getting, it's digitalized. So you could go through the entire Augusta ecosystem up until pregnancy, and everything is recorded. So even 15 years later, if you want to know what happened during your pregnancy, the records are there. So Augusta is a product not only from a public sector, from a private sector. We want to encourage institutions to collaborate with us, to help us help them in terms of using data, which is the future of healthcare, and making it a standard. So we have nurses like, Ida Jallo, who graduated from nursing school, and she started working with us. She has never lived in a world where she doesn't use electronic health record systems. So the human development that's happening, it's mind-blowing. And I think for electronic health record systems, for Bundung, for example, the reason why it's successful, our nurses are training their healthcare professionals. So there's a level of trust and camaraderie when a healthcare professional is implementing a healthcare system versus somebody who's technical, like a software developer, trying to teach a nurse who's never used electronic health record system on how to use a tool. And I think that's why the success at Bundung is something I want the world to know about, because it shows that everybody will tell you why it cannot work. But I think we have to move to the era of Gambia or Africa that we persist on why it will work. However long it takes. Internet is down sometimes, that's fine. We keep on. We use AfriCell backups. We use QCell backups. The work continues. So Augusta could really, for us, Augusta is an Africa project. That's why when I made a relationship with Augusta, I told them, I don't want to buy this from you. I want us to build a relationship where Augusta and IGH becomes an entity in Africa. So that's the relationship we built. We're rolling it out in the Gambia. I think there's a lot of private institutions that we could make it relatively affordable.
That's what I was going to say. Is there any plans to roll it to other?
At this point, any place that you're seeing patients, you're Augusta ready. Systems like the vaccination programs, the testing, any institution that wants to go digital, I think what most people spend on paper alone covers for a cloud-based system that allows you to have a wellness on wheels, because my guys are in Basse. And even if they check somebody's blood pressure in Basse, the same instant, we see it on the screen. That's the future of healthcare.
That's the future.
We can't run away from it.
We can't run away. COVID have pushed us all to that. So I think Gambia should try to be ready. So, but I recently saw this announcement, the Startup Health.
Startup Health,
what is this all about?
So the Startup Health opportunity is really exciting, and I'll tell you why. So Startup Health, they believe in they have these moonshots where access to care, for example, is one of them.
Yeah.
Where they identify companies, budding companies in the healthcare space that are startups that show promise in delivering these moonshots of increasing access to care. So when we saw the opportunity, we put in a bid, applied, went through a long due diligence process, and we got accepted. So what happens is they give you a token investment, but also they prepare you to go scale. Because for us, it meant a lot because the Gambian ecosystem has always been known to not be friendly for businesses.
Yep.
We don't attract venture capitalists. A lot of startup companies don't get to a point where they become a regional entity.
Yep.
I think we can be that from a healthcare, because I think our idea, our solutions are not a Gambia solution. We were intentional about Gambia being the place that we tested it. 2.5 million people. You could go Banjul to Basse in a day.
Yeah.
But startup health for us was just a great opportunity to align with a global entity of like-minded people who just want to solve human problems.
Yeah.
So it's something we're extremely excited about. The journey is just beginning with them.
Yeah.
And I think for Gambia, it puts a good light.
Yeah.
So we represent the Gambian people to them.
Wow.
We represent the Africa continent to them. And I wish by us being on that global platform, it'll give confidence to people in the diaspora as well that have any idea that Gambia, you could start in Gambia with a global idea and then venture out and still keep it on the same competitive level as any company in the world. And I think that's what Startup Health did for us.
That's interesting.
Yeah.
Wow, congratulations.
Thank you.
So finally, before we go, what do you expect in the coming years, like next year especially? When I come here next year, what do I look at? Where will we be at in the next 1 year?
Constantly evolving. I think what we want to do with technology, Fatou, we're just scratching the surface, to be honest, because of the human element. And I still go back to the human development part of it. We have to invest and infuse confidence in young Africans to deliver things of value consistently. So what's coming is how do we keep pushing the envelope with technology to reach more homes, not only in Gambia and Africa. We want to be in a sub-region. We want to get to a point where you could be visiting Ghana or Nigeria and use an interconnected system of healthcare where your doctor could still be in Banjul and you use Augusta and the communication happens. So growth, we're at a phase right now where internally, continuous improvements, continuously holding ourselves accountable. We believe in using a mirror with the company. How are we doing? What are we doing to improve? How are we being better for our patients? So that's going to continue growing, investing in Gambian professionals, paying professionals a living wage, even if it's 20, 30% of our revenue. We believe in that. But technology, I think I'm excited about some of the things that we have in store with technology. We want to strengthen our relationship with the local ecosystem. That's something I still wish could be more in terms of just being integrated, working hand in hand with all the stakeholders so that they don't see us as competitors, but as collaborators. It doesn't have to be only one. It could be many, because then it just increases value. So yeah, that's what's coming. It's really, really exciting. Our company is growing very fast internally and with opportunities. And I just hope we still keep it where we give people that look like us the care that they deserve all the time.
All the time.
That's the goal.
Thank you very much, Dr. Baji. And finally, to your clients, especially the new patients who are looking forward to walking through this door. They don't have to worry about the bills, right?
No, they don't.
It's affordable. I walk through the aisles and I see $150, $100. I'm like, really?
It's inexpensive. I think there's a myth that something that comes from the US is expensive. But what makes products expensive is how many hands is it exchanging with middlemen before it arrives to the consumer. So what good relationships do, like our quality choice relationships, we're buying directly at the same places that local pharmacies in the US are buying, so we could bring it and still be equally competitive. And I think more and more people, I always urge people, go on our website, see a product, then go on a US website and see a product. It's actually cheaper now to get a lot of tests done here with medications than it is in the US. But I think something I have to mention, Fatou, is I have to thank our early customers, yourself included, for being patient with our growth. For me, you know how I am. I'm always asking for feedback because I know what intentions I have for the company delivering a level of service. So anytime people that are early adopters in your business and they stick with you through your growing pains, to me, that's a value and level of gratitude I don't take for granted. And these people are people in the diaspora who probably knew me on a personal level. And they're giving us time to constantly improve and get better. So those are the people I always want to make out. People like yourself, people who supported us in the beginning and know that Gambia is a very difficult terrain for a startup to thrive. So I just have to say thank you to them and for them to just keep watching, because I think we're really, really excited about what's coming for the company and for them.
And I think all of us are excited too, because it makes life easy for all of us. For me, I hate going to hospitals. So sitting in my office and getting all my tests done at my office, getting my grandmother's medication delivered to her every month, because sometimes like her medication is finished and I don't really have the time to go pick it up. But with you guys, they know it's time to get her medication delivered. That makes it much more easier. It's worth everything. It is. You know, if you have patients like that. So those are the things that really encourages me and so many other customers. And I just hope you guys continue on that.
It helps the hospital systems. I think my level of reverence, respect, admiration for Gambian healthcare professionals is so high. That's why anytime I hear people say something negative about Gambian healthcare professionals, I stop and tell them, you don't know how much these people are doing with so little. So the more institutions of quality that exist that cover preventative services allows them to do their job with less burden. And I think that's something I've always been grateful for, the relationships that we have with local healthcare professionals. Because Gambia has been tough, and we haven't seen any time in Gambian history where our health system is
prepared for anything.
But we have some of the most resilient healthcare workers, and they deserve a lot of praise.
And it's been really tough, especially during the COVID period.
Very limited resources. They perform magic. That's what I tell them all the time. A lot of our healthcare professionals perform magic and still wake up every single day and choose to go back to work. It takes a special human being to have that dedication to humanity. So it goes definitely a long way.
It does. And we want to thank all of you for your services, because this has been a tough year. And whilst we are staying home, you're always there at the front lines to look after all the patients. And we want to thank you very much. And I want to thank you and your entire team. This has been home for me and my entire family.
Absolutely, from day one.
Yes, and because also we get good service whenever we come. You know, my uncle, we almost, I remember calling you. I was called, he was not even able to walk. It was really tough for the family. And the first thing I thought about was you, because we could not take him to the hospital. Your team went to visit him. And today I can proudly say he's doing amazing. Yes, he's recovering, he's doing very well. My grandmother, your team always visit at home. So these are the kind of things, stories that we want to tell. And it's encouraging that we can have a service like this in Gambia, not even in the US that you get this kind of service.
I tell people all the time, not even in the US.
Not even in the US.
Yeah, not in the US.
Not even in the US. So something like this is really something I proudly take pride in, in telling the stories, because I think it's important for people to know the kind of services you offer, but how also it's impactful in our lives. People like me are busy, but we can always take care of ourselves.
You guys covered.
At home,
Definitely.
Yeah, thank you very much. And
thank you so much.
And I want to thank your team, Hadi, Tijan, and the rest of the team for always, working tirelessly to get us to do all of this. Thank you very much.
Thank you, Fatou, always.
Thank you.
Excellent.
Bye-bye, and good night to you all. See you another time.
Awesome.
Bye.
waaw love love like fire xam ngeen rek affaire bi xam ngeen fan la skincare la 2020 lañ wax de waaw fii nag mooy Kerr fan Kerr zero tache perfect skincare saa su ne rek niñ ko dee defee rek loo lañ soxlaati rek maanaam bu ngeen am problème ci seen skin yéen xam ngeen fan la fii ngeen di ñëw suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal ba la ka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi defee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw fii ngeen di ñëw skincare plus si yu baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indilee products bu dee tamit nag da nga ñuul rek ñu lay jamaa natural beauty that melanin dripping we do have stuff for you as well emuñ si skincare products rek ñu ngi ci cuub yi tamit fu ne la ñoo jaar in fact sax last commercial bi ñu defoon waxuñ leen woon ne dañoo dox ci ay kawar 9A grade rek nag waaw we do have bundles as well hair si lu ne la ñoo dox ñun ñu ngi ci rafetal jigéen rek luy taaral jigéen rek waaw boo leen di tukki tamit bëggoon rek classic suitcase ñu dañoo dox ci ay Samsonite duñ dee indi any brand of suitcases though other than Samsonite comme li ma dee wax rek boo eggee airport dëri Samsonite dafa am nuñ laa xoolee waaw ngeen ne lan nag waaw skin ci moom la ñu gën a xamee nag skin care products ci moom la ñu gën a xamee ñu ngi dox tamit bentee tamit si ay dàlla man waaye man nag skin care mooy suma specialty xam nga rek jigéen bu sa xar kanam réglé loo def mu jag am nañ Patricia Reiner Kiwi Eye the whole range Lighten Up Gold Tomatine I mean the list can just go on and on and on and on lépp loo xam ne rek luy taaral jigéen la ci yooyu rek la ñoo dox skin care plus nag emuñ si Gambia rek ñu nga United States ñu ngi Gambia fii ba pare bu dee yaa ngi anywhere in Europe mun nañ la ko mail within 3 days rek ñetti fan rek nga jot say diw emuñ si loolu rek dañ laa consult tamit balaa ñu laa jaay diw dinañ def a free consultation pour wax la rek exactly li nga xam ne moo méngoo ak sa kanam dinañ leen wax tamit ne rek am nañ perfumes you know fragrances men's shirts accessories we do dresses as well we do blouses I mean we do shoes name it we do them Skincare Plus 2020 is our year of perfection zero task fi mu nekk nii réew mi fii kenn waratu fi taas kenn waratu fi am problème kanam kenn waratu fi am problème yu picca boo ko amee dafa fekk ne rek ñëwuloo ci place bi fii
Love like fire. Bring my love like fire.
Agada
ke mbijan no aga nyaade
albaka
mbaka important
yo nga transfer la sto
ya transfer la
ha code nyenje
okay person nsila id soto
ha sa so sorry agada
mbijan ro
albaka
mbaka
bara alla service o tariya
mbare
mo ki janna nun kunu bara tariya
jannom yona forest de bureau gambia tonkon na no mbari ya bere birin koyna fo kato
bari si kodo kino kato nim fo bolong labe
56 branches mola sota gambia ja gambia kono ani gambia bantala bankol nko kono kiya bele kodo sifa fo falindiro fo nyaadi lafta memmen na kodi to poto nin kodi maraw jannam number 1 di nyonta andum fana nata anoda enterprise sotale wolam nyindi ko domorol fana kol fana be firale de dadi mani domorol dil fana beteat gambia dawda yalo ngam fa kendol sotale di
wo moyo diat
apelenta
ni wo ka ni lafta nyelen kendol e binaji
yalo bu kanyi la ko la baraka ba
yalo ndel ciosano lo
baraka
We live in a day and age where technology is creating a world without borders, filled with unlimited potential to improve the lives of the people around us. Innovarax Global Health ushers in a new way of leveling the playing field with increased access to quality healthcare services delivered at your doorstep. Our qualified professionals are equipped with state-of-the-art point-of-care testing technology to conduct tests such as kidney function, liver function, electrolyte tests, body composition, hemoglobin, A1C, and many more services with the highest efficiency in delivering results. The addition to our flagship Wellness on Wheels, more fondly known as WOW Delivery Service, brings the entire clinical experience full circle. IGH has remained committed to creating the future of healthcare delivery. Gone are the days of sending loved ones outside the country for basic medical services. Innovarax Global Health offers a new peace of mind and takes pride in delivering the quality of care we all deserve.
When we touch down, better broke down.
With Gamtel G Fiber, now you can enjoy super fast internet in gigabytes. G Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G Fiber, the future is speed. Gamtel, creating a brighter future in communication.
That's how she became mine and see that.